This video will demonstrate and explain the rehabilitation for a grade 2 anterior cruciate ligament sprain. These exercises will improve the strength, range of motion, and proprioception at the knee joint. For the isometric contractions, the patient sits on the floor with their legs fully extended and contracts their quadricep muscle. Each contraction should be held for 5 seconds and done twice a day. This involves 3 sets of 10 reps. Reps represent the word repetitions and indicate how many times the exercise must be repeated, while sets indicate how many times the full repetitions must be repeated. The progression involves standing isometric contractions. This exercise is weight-bearing and can be used to develop more strength at the knee joint. This should only be attempted if the patient is able to perform the seated isometric contractions comfortably and pain-free. This exercise should be done in a seated position. The patient needs to extend their leg as far as they possibly can without causing too much pain. Then, the patient brings their leg back underneath the chair. This should be done twice a day and involves 3 sets of 10 reps. This exercise has the patient do squats using the wall as support. The patient can move through a quarter, half, or full range of motion based on how comfortable it is. This should be done twice a day and involves 3 sets of 10 reps. The progression involves freestanding squats. The patient can attempt this exercise if they can go through the full range of motion during the wall-assisted squats without pain. This should also be done twice a day and involves 3 sets of 10 reps. The heel slide exercise has the patient sit down with their legs fully extended. They slide the heel towards their butt as far as they can. Then, slide their heel back out until full extension is attained. This should be done twice daily and involves 3 sets of 10 reps. The progression of the heel slide involves using a TheraBand to add a resistive aspect to the exercise during extension. This version of the exercise allows the patient to improve their range of motion further and should only be attempted if the patient can move through the previous version of the exercise without pain. The wall slide exercise has the patient lie on their back with their feet on the wall and their knees bent at 90 degrees. They extend their leg up the wall, making sure to keep their toes and heel flush to the surface. Then, they bring their leg back down as far as they can. This exercise should be done twice a day and involves 3 sets of 10 reps. The unweighted leg cycle exercise has the patient lie on their back with their feet on the ground and their knees bent at 90 degrees. The patient extends their leg fully, raising their foot off the ground, then in a circular motion bring their foot back into a flexed position. This should be done twice a day and involves 2 sets of 10 cycles, one cycle being a full extension and flexion on both legs. Ankle weights can be added for progression. This exercise has the patient balance on one leg with their eyes open and must be done on both legs. The patient holds this position for 15 seconds. This is done twice a day and involves 2 sets of 3 reps per leg. The patient can also use the wall for support while balancing. The more difficult version of this exercise is done with both eyes closed and should be held for 5 seconds. Once the patient can do this comfortably and without pain, they can progress to 10, then 15 seconds. The next exercise has the patient do squats on the rounded surface of the Bosu ball. The patient can go through a quarter, half, or full range of motion depending on how comfortable they are. This should be done twice a day and involves 3 sets of 10 reps. If this shows to be too difficult, the patient can choose to just balance on the Bosu ball and exclude the squats. The progression has the patient stand on the flat side of the Bosu ball and complete squats. They can do the squats to a quarter, half, or full range of motion. This increases the amount of difficulty substantially and requires more balance. Again, if this is too difficult, the patient can revert back to the last exercise.